And thank you everybody for being here, and I'd like to thank the organizers of this event for asking me to speak. I am always delighted when I get asked to speak, because I guess that means I'm doing a good job. I'm particularly sensitive to the Cancer Society. They've been very good about trying to get the word out there about colon cancer. Just recently, my mother was diagnosed with breast cancer, and she had all of her, mastectomy and the chemo and the radiation, and they were so impressed at how the Cancer Society, they were in Charlotte, North Carolina, but the Cancer Society was so helpful to them, and they had volunteers that would pick them up and take them to get the radiation, and there's Kefi, and Kefi was instrumental in keeping my mother's spirits up. I'm happy anytime the Cancer Society calls on me to do a lecture, and I hope that you learn something from this one that I'm going to do today. So I'm going to talk about colon cancer screening. And sometimes you'll hear colon cancer, and sometimes you'll hear colorectal cancer. And on occasion, people ask me if there's a difference. The colon is the same thing as the large intestine. So back when you were in high school and you weren't paying attention, somewhere during that lecture, they mentioned colorectal being synonymous with the colon. So the large intestine is divided into two parts. One is the colon is pretty much the entire large intestine, and then the end is the rectum. So when you hear the term colorectal cancer, it just means anywhere in the large intestine. Okay, so we always get lots of information about how many people get diagnosed with colon or rectal cancer in the United States. And these are some of the numbers that I pulled up last night. So this is a pretty common disease. It's not as rare as we think it is. 95,000 new cases expected in 2017. And 50,000, just over 50,000 deaths expected. So that's almost half. So just about half of the people who are diagnosed with colon cancer actually die from the disease. And what's ironic about that is that colon cancer is pretty much preventable. It's one of the only cancers that if you get screened early enough, you can completely eliminate your risk. So it's really disheartening when you see that half the people who get diagnosed come in so late that we can't do anything about it. And that's the whole purpose of colon cancer screening. When I came back home to the Bahamas in 2009, I started to kind of put together the data of how much colon cancer we see in the Bahamas. So this is a slide that I actually got from Dr. Grace Stewart, and this was pretty much prior to when I came home, but it kind of shows what the cancer statistics are like in the Bahamas. And this information was taken from the Princess Margaret Hospital only, but you can see after breast cancer here and prostate cancer here, colon cancer is third. So it's the second most common cancer in men and women, because women will not get prostate cancer. Most women, I don't think, will get prostate cancer. Although you do have men that will get breast cancer. Both men and women are at risk of getting colon cancer, and so both men and women should get screened. So I started this in 2011. So this is from 2011, 12, and 2013. So over a 3-year period, we found in both Princess Margaret Hospital and Doctors Hospital about just under 200 cases over the 3 years, which is not that much, but we think that we lose lots of cases to people who go abroad to get their treatment. We weren't able to get the data from Freeport as well. So we know that we get more than 200, well, I would say more than 60 cases probably per year here, which gives us an incidence rate of 16.5, which is pretty much average with what we see in other countries in the region. And like I mentioned before, even though we have a few more cases that are seen in men, both men and women are pretty much equally affected. This is what we found as far as where we found the cancers located. And this is probably more interesting to Dr. Shea than you, but there is something that's important about this fact. So People who come in with advanced colon cancer, the reason why we want people to get screened when they're asymptomatic, when they're not feeling anything, is because you can have colon cancers that developed on the right side here, and you don't feel anything. So when you have a lump or a mass that's on the left side, just before the rectum, when your stool comes out, if something starts to grow here, you probably will get constipated, or you'll have a change in your bowel habits. You may see some blood in the stools. When you have colon cancer developing on the left side is where the stools are still liquid. Oh, so right, sorry, yeah, my other left. So on the right side of the colon are where the stools are still liquid. And so you can have something growing in here for a very long time and not causing a problem. Whereas over here, as it starts to grow on the left side, you'll start to get probably some abdominal pain, you'll notice a change in your bowel habits, and you're more likely to see blood in your stools. So you can see here that about a third of the cases that we found were on the right side. That means that these people are probably going to present very, very late as a late stage colon cancer. And a lot of times these people will present with weight loss, or they've lost their appetite, or they may see blood in the stools, but probably not, because by the time the blood passes all the way through the colon, it's been digested and denatured and you won't see it. So these people tend to present late. So a third of the people who get diagnosed with colon cancer, we probably didn't catch them in time to do something really good about it. And this was our age distribution. So the majority of people you can see between the ages of 50 and 75. That's important because the prior recommendations by most of the medical societies was that we start colon cancer screening at the age of 50. But you can see just about 20% of the people that we found were diagnosed before the age of 50. So the American guidelines have actually changed, and the recommendations that we made to the local authorities is that we start screening at 45 because we want to catch some of these people. We're seeing people in their 30s being diagnosed with colon cancer. I actually had a gentleman just a few weeks ago at the age of 29. And so we're seeing colon cancers at much younger ages. People are seeing blood in their stools, and their auntie or their cousin or somebody told them, oh, that's probably just hemorrhoids. And so they don't get it checked out, and we're getting more advanced cancers in younger people. So we're trying to get the word out that even though previously we were saying the age of 50, now at 45, before any symptoms occur, we don't want people to wait until they have pain. People say all the time, well, you know, I'm regular, I don't have any pain, I feel fine. That's the perfect time to get a colonoscopy, and I'm going to show you why in a few slides. So we don't want people presenting at advanced stage, and this is just, you know, we always hear people talk about the stage of cancer. And for those of you who are survivors, or for those of you who are familiar, anytime there's a stage 4, you know that that's bad. When you have stage 0, stage 1, that's a whole lot better. One thing that's not funny, but you know, when people talk to other people about cancer, you only hear the bad stories, all right? You never hear the success stories. You very rarely hear about the people who've done well. You just hear, oh, that chemo can kill you, and it can make you sick, and all this other stuff. And so it's really important to kind of know the stage, because some people will present at stage 4, and you have to give them very aggressive treatment. But other people will start at stage 1, and they won't have to. So everybody's story is different, and if you don't know at what stage somebody presents at, your story will always be different to theirs. So this is kind of just pretty much showing the same thing, that most people were diagnosed between the ages of 50 and 75, but we had some numbers that were earlier than 50 and some that were after 75. Again, I just want to reiterate that now the screening, when you're talking to your friends and your relatives, even those that are in their 40s, should be getting screened. What are some of the risk factors for colon cancer? So obesity is always listed. Obesity probably accounts for 97% of Bahamian population. because we're all overweight to some degree, especially if you look at what's called the BMI scales. Bahamians just tend to have bigger bones, I guess. we like to say that we're big-boned. So us big-boned people are probably at a little more risk of developing colon cancer than others. But the reason why obesity is important is because this has a lot to do with diet. And if you have social media and you see these videos that are floating around about the cheese that doesn't melt and the rice made out of plastic and the bugs that they find in this and that, it's always on, right? But some of those things are true and some are not. But I do believe that what we eat is killing us. And in the Bahamas, our diets are very, very low in fiber. So I meant to include a picture, I had it on another talk, but if you Google the Bahamian diet and you go to images, it will show you a picture of fish on one plate, pork chops, rice, macaroni, and potato salad. That's the picture. There is not a green piece of vegetable in sight. There is a lime on the side of the fish, but there are no vegetables. And that's the typical, and think about it, that's day in and day out for quite a few people, especially people who work and they kind of run out to some fast food place to get food. That's every single day. And if you think about the fact that we don't really manufacture here, and we don't have a large produce market, and we import all of our meats, when you start to think about the things that they put in food so that it looks good by the time it gets here, and so that it stays fresh and it looks red, all of these things I think are contributing to the high rates of colon cancer that we see, and at younger ages as well. I mean, I went to a party the other day and I had some Tampico juice that they're giving to the kids. I don't know if you ever had Tampico, but that thing has got to have, I mean, that's worse than Kool-Aid, right? It's like syrup. And the kids are getting this at 2, 3, right out of the bottle, they're getting Tampico, right? So our diets play a huge role in a lot of the pathology, a lot of the sickness and the illness that we see. No different with colon cancer, smoking, that high-fat, low-fiber diet, which is a typical Bahamian diet, and family history. So if you've had someone in particularly a first-degree relative, who's been diagnosed with colon cancer, or even had a colon polyp found at a colonoscopy, that actually puts you at an increased risk of developing colon cancer yourself. Okay, so what we know now is that at the age of 50, and it should be actually 45, we're starting to screen for cancer. This has been highlighted that particularly in black people and people of African descent, they're presenting with more severe cancers. They're presenting with advanced stage 3 and stage 4. They're doing worse, so we want to catch these people early. And sometimes, and this holds true in the Bahamas as well as in the United States, but in the disadvantaged populations where people are not getting their medical care as frequently, we're starting to see a lot more aggressive disease, not just colon cancer, but everything else. Hopefully NHI will solve this problem, and we will know how swiftly NHI comes into effect after May 15th, it is? 10th, because plans may change, but we'll see. Okay, so I wanted to talk briefly about some of the options for colon cancer screening. So everybody knows about the colonoscopy. It's not showing up so well because it's in red. But colonoscopy is considered the gold standard. We can see when there's a problem. If we see a polyp, we can take it out. And it's relatively, it's painless. It is considered an invasive procedure. It's not painless? Okay, it's not painless. So I'm going to talk about that too. The worst part of the colonoscopy is usually the day before. It's the prep. So you're sedated for the actual colonoscopy. Most times you don't feel it. You might have a little bit of cramping from the air afterwards, but if you give a good hard that goes away in a few seconds. So colonoscopy is considered the gold standard, but there are options. So one thing with NHI, if NHI becomes a reality, the colon cancer screening option will be this, the FIT test. The FIT test is like a card. So it's a stool test. Now, depending on the type of FIT test will determine whether it's a card or if it's a tube. But basically, they will give you a container or a card, and they will send you home with it with some instructions, and you're supposed to place a stool sample on the card and bring it back to your physician, who will then process it and see if there's any blood in it. So this is something that the NHI Secretariat has approved as a method of colon cancer screening nationwide. It's easy to deliver, it's painless, it doesn't require any sedation, and it's cheap. And it is considered, even in other countries, this has become the initial way of checking for colon cancer in the entire population. Once you find a positive test, that means that there's some blood that was detected, and then you need to go and have a colonoscopy. So you're probably going to be hearing a lot more about this stool test in the next couple of months as NHI begins to develop. But this is an acceptable method of colon cancer screening. Colonoscopies are done every 7 to 10 years. So if you have a normal colonoscopy, you don't have to have it done every year, or every 2 years, or every 3 years. It's every 7 to 10. This has to be done every year. And in some countries, they space it out to every other year. The other thing that's important about this test is that it doesn't really prevent colon cancer, but it will detect it early because of the small amounts of blood that are picked up on the card. A flexible sigmoidoscopy is just like a colonoscopy, but doesn't usually require sedation. Stool test for DNA, you'll hear lots about that if you watch TV. They're always talking about these DNA tests that are available. They're very expensive, and they're not usually offered to the entire population. Barium enemas is something that we still do in the hospital setting, and you may have been referred for a barium enema if you've had some other medical illness like heart disease or lung disease that may make you a difficult candidate for a colonoscopy. And then a virtual colonoscopy. So our friend Liz Darville has been, and Doctors Hospital, have been promoting this virtual colonoscopy. It's like a CT scan, and I'll show you a bit more about that later, but that's also an option. So I mentioned some of the pros. It's non-invasive. There's no sedation required. It is less expensive. Because it's a CT scan, we can see other things outside of the colon. We can see your liver and your kidneys. And sometimes when I have people who come to me for abdominal pain and I'm not quite sure where it may be, I'll order a virtual colonoscopy because I can get to see all the other organs at the same time. The downside is that it's only diagnostic. If there's a polyp, we can't take it out. It still requires that dreaded prep, and it's less sensitive for smaller lesions. So I mentioned this already about the increased risk in people who have a first-degree relative who has colon cancer. If you have 2 first-degree relatives, that really increases your risk, and that tells us that there's probably some genetic abnormality going on. Does anybody know what the symptoms of early colon cancer are? Weight loss, blood and stool, cramping, constipation, and flattened stools. Okay, so this is why it's so important for us to get up this D average in our schools, because all of you are wrong. We got to work on our educational system. So those are all symptoms of late colon cancer. That was a trick. That was a trick question.
You said that there weren't any.
There aren't any. And that's the thing that I try to impress on people. When it's very early, you're not going to feel anything. And it's not until it's late, when it's a real problem, do you have those things. Do you start to see the blood in the stool? Do you get the cramping because now it's so big that it's narrowing the size of your colon that you start to lose weight? Those are bad signs. So that's not early usually by that time. That's late. So the colonoscopy is important when you don't feel anything. And when you talk to your friends and your relatives, that's the point that I want you to stress to them, that don't wait until you feel something. By that time, it's too late. So those are some of the things that you all mentioned. Iron deficiency anemia. So people, Bahamians, we like to say, I'm anemic. Like it's a badge of honor. Especially when you go in when people actually give blood, you'd be like, I'm anemic, I can't do that. But iron deficiency anemia is not a diagnosis. And when I say that, there should always be a reason why you're anemic. A doctor should not say, oh, you're anemic, and put you on iron tablets. There's a reason why, and you want to know why. Sometimes it may be just something as simple as you, as being a woman who's having her menses every month. That's fine. At least we know what it is. So you might have sickle cell, or you might have some other problem. You might be on medication. But just being diagnosed with anemia is not enough, especially as you get older. A lot of times that can be an indication that something is wrong. Unintentional weight loss, change in bowel habits. So not just becoming constipated, but if you have frequent bowel movements, that can also be a sign. So if you were previously a once every other day person and now you're going 3 times a day, that's also a problem, right? So any change in your bowel habits, unexplained abdominal pain, if you had an x-ray or CT scan that showed something suspicious, these are all reasons why you should get a colonoscopy. Okay, so the dreaded prep. So if you've had a colonoscopy, you've probably gotten one of these or something that looks like it. So back in the day, they used to use citroma, right? That's cruel and unusual punishment. And it doesn't work well. So we've now moved towards Miralax with Gatorade. This is a more friendly prep if you can deal with the Gatorade. This is not the right size bottle. This is a 64-ounce one. But it's still Gatorade. It doesn't taste bad. I use this sometimes, but it takes the very diligent person to do it right and somebody who doesn't have constipation. When I feel like, either you're not going to follow the instructions properly or you have a history of constipation, I go for the liquid Drano. So this is industrial strength colon cleanser. Nothing stands up to this. So once you drink it, I know you're going to be clean, okay? The key to your preparation, though, and this is why people sometimes like, oh, it's so awful, is because they go home, they sit down, they watch TV, they drink this gallon of stuff, they're sitting there, it sits in your stomach, it makes you nauseous, you want to vomit. That's not the way to do it, right? You gotta treat it like a cocktail. So I tell them, put it in the fridge, add some cranberry juice or apple juice or whatever one is your favorite to give it some taste, and as you're drinking it, you keep moving. Gravity will suck it right through. It'll be a lot more tolerable, and the process finishes a lot more quickly, a lot quicker. So it's not that bad, but it's definitely the worst part of the whole procedure. And they used to give this over 2 days. Now it's just a 1-day prep. Okay, you're on a liquid diet. You drink this in the afternoon, and that's the end of it. So I use the slide here just to show that. Usually people are looking for the easy way out. They say, oh, this is so much volume. Can you give me something else? But you really only want to do this one time. And if you get a normal colonoscopy, it's not for another 7 to 10 years that you have to do it. If you take the easy way out and you say, Doc, I couldn't drink all the prep, chances are you're going to have a poor prep. We're not going to be able to see good. We're not going to be able to tell you, okay, your colon's completely clean. You don't have to come back for 7 years. You're going to have to come back earlier, or we're going to have to repeat it, even worse. So I guess the moral of the story is try to do it right the first time. So this is what a clean colon looks like. It's important that we see all the folds. It allows us to detect what we're looking for is polyps, right? So this doesn't show well, but you can see this is what a small polyp looks like. This is what a bigger polyp looks like, and this is cancer. So you can see here the lumen, the opening of the colon is nice and round and wide, but here it's very narrow. And that's why you start to get the cramping, and that's why your stools come out looking pencil thin. And this is friable, it bleeds very easily when you touch it, and that's why you see blood in your stools. So we want to catch you at this stage where you don't feel this thing at all. And it'll take me 60 seconds to remove it. That's why we want people to have colonoscopies early. and I showed you virtual colonoscopy already. So that's pretty much all that I have to say. I often get the question about what can a person do to prevent themselves from getting colon cancer? The medical literature is not overwhelmingly supportive of what you can do. There's diet, of course, is a very big part of that. There's some that says if you take NSAIDs, which is like baby aspirin a day, it'll reduce your risk of getting colon cancer. Aspirin is also good for preventing heart attacks and stroke. There's other things that talk about daily folic acid as reducing your risk of getting colon cancer, calcium supplements, supplemental fiber. So we don't have overwhelming evidence for any one of these things. There are some small studies that show that it's possible that by doing this you can reduce your risk. My advice to people is to eat healthy, to exercise, and to get checked out. And those are probably the best things that you can do. Colon cancer is preventable. We don't have to see anybody dying from colon cancer. Some people say, oh, I'd rather not know. You rather know. You rather know. Trust me on that. So talk to your friends and relatives. Tell them to get screened. There's lots of options. And I'll be happy to talk to them if they want to talk to me. Thank you very much.
At the brink of the hill on East Terrace is the Cancer Caring Center, a comfortable, secure, and tranquil space. This two-story facility has 10 spacious double-occupancy bedrooms, each with an adjoining balcony that overlooks southern New Providence. It's the ideal home away from home for our Family Island patients.
Patients referred by our branches in Abaco, Central, South, North Andros, Cat Island, San Salvador, Luthra, Exuma, and Freeport Grand Bahama, as well as other family islands, receive white glove treatment.
The Caring Center is staffed by a qualified team who exemplify the center's motto, caring and sharing. For more information about the Cancer Society's Cancer Caring Center, call us at 323-4482 or 323-4441.